So we need to see if there are any empty seats. Let's take our seats. Kila mmoja wetu aketi tafadhali. Kila mmoja wetu aketi. Tafadhali. Studio. Studio. Thank you. Let me have your attention, please. I just need to give the last instructions before we begin. I need total silence. Kindly, I need total silence. This is a studio production. Tafadhali, naomba sote tusikize. The gentlemen who are still standing there, I don't know why we are standing. Mwai, tuketi. Take our seats, please. As you can see, His Excellency is already within the building, having the last brief before he comes in. So please, I need your attention. Listen, once we begin the production at 7, I keep repeating it's a TV production because we're going to be live on air. You're going to be on TV. So once we begin at 7, Dr. Mercy Korir will start with a global intro. Then at some point, she's going to ask us to stand as His Excellency is walking in. Are we together? At the point she says we stand, we shall clap until His Excellency is on stage. Mpaka afike hapa. After which we stop the clapping. Once he's on stage, we'll naturally stop the clap. Then we'll be asked to sit down and we continue with the production. I would want us to practice the clap tafadhali. Hebu tupige makofi sisi wote. Unaona ngoja. Kuna wale hawapigi makofi. Please. Na ni kwa sababu hatusikizi. Hebu mgeukie mwenzako mwambie shh. Thank you. So what I'm saying is, once we begin the production, you'll see Dr. Mercy Korir on the screen, and you'll already tell that we are live on air. Once His Excellency is just near the door, she will ask us to stand and clap. We shall clap from the time he's there until he's on stage. Na nataka tujaribu hiyo clap. Hebu tupige makofi tafadhali. Mekuja, keep clapping, na ikuwe loud. Hivyo. Haya, good. I think we're ready to begin. We have another 5 minutes. Once you see Waziri coming in, it'll be a clear indicator that the next person coming in now will be His Excellency the President. Monica, in the OB van, kindly, if we can have a test of Lamu, that would be very good, so that we are confident we are ready to begin. Otherwise, we are good on this end, and I'll hand over the mic to Dr. Mercy Korir in case she wants to test her global intro. as you please, but the underscore there is with respect and equal. Otherwise, we are now ready to begin. It's 7 o'clock. So shortly we'll have Waziri and those who are with His Excellency walking in, leaving His Excellency in the holding room alone as he gets ready to walk in at around 10 minutes after 7. Otherwise, tuko tayari, asanteni sana, and we're looking forward to a good production.
PSs, the PS Ministry of Health, State Department of Medical Services, and the PS Public Health are just walking into the room. We are about to start this town hall. Let's appreciate the CS and the PSs as they walk into the room, and Governor Nairobi County. We are about to start. Thank you, CS, PSs, and Governor. Please have your seats.
Good evening, Kenya, and welcome to this presidential town hall conversation on health. My name is Dr. Mercy Korir. Our constitution makes a solemn promise that every Kenyan has the right to the highest attainable standard of health, and that no person should be denied emergency medical treatment. For far too long, the experience of many families tell or fall short of that promise. In 2022, President William Ruto promised to change that reality, to build a health system in which care is a right for every Kenyan, not a privilege for those who can afford it. 4 years later, the question before us is simple. Of today than they were then. The answer must be found in the lives of real people. The mother who delivered safely facing a crippling bill. The cancer patient receiving specialized treatment closer to their home. That grandfather whose dialysis is now covered. And the family visited by a community health promoter before a manageable condition became a medical emergency. That is why we are here this evening, not merely to recite or enumerate what has been done, but to examine what has changed, not only to celebrate progress, but to confront the gaps that remain, and not simply to speak about citizens, but to hear directly from them, from you who is in this room tonight. Tonight, patients, families, community health promoters, doctors, nurses, hospital administrators, and public health officials and other public officials will help us test the reform against lived experience. Because the true measure of health reform is not the institution created. It's not the money allocated or the policy announced. It is that patient who has been treated, the life saved, the cost avoided, and the family that has been protected. Ladies and gentlemen, welcome to an open conversation about the progress Kenya has made, the work that remains, and what it will take to make quality healthcare reliable and accessible for every Kenyan. Let's begin.
Do hereby commit to establish the Hustler Health Care Program. By December 2022, every Kenyan, including every Kenyan woman, shall be insured or shall have health insurance at affordable premiums, and where they cannot afford, the government of Kenya will pay for the women who cannot pay. Secondly, I commit to ensure that adequate numbers of community health volunteers and establish a cost-sharing framework between national and county governments in the payment of their stipends. I commit to provide mothers of newborn babies with diapers for their children for a minimum of 3 months paid for by the government of Kenya. We are not having a conversation about politics. We are having a conversation about life. We are having a conversation about our loved ones, people we cherish and people we love.
36% of Kenyan households, 1 out of 3 households, is at the risk of being impoverished by a catastrophic illness costs. 1 out of 3 Kenyans.
We must figure out how we are going to start at the bottom. How the health center, how the dispensary, how the community health worker is going to be empowered sufficiently to be able to deal with the challenge right at the root. A conversation if about the dispensary politics is working. We're having a conversation about if the 5 will work.
I want to talk about, which I know you can make an immediate impact, is healthcare financing. I think we should have a mixed model of health financing. Let me explain a bit. In financing, again, support both public risk pooling and private risk pooling. And you've mentioned it many times. And if you can contribute to NHIF according to your salary scale, rather than just a fixed 1,700 shillings, and it is pegged on salary, we could be considering it as a levy.
When we had the issue of emergency response, and this is a challenge that has been going back and forth. You have got people who get accidents and they rush to health facilities. Who is supposed to meet those bills? There was a proposal in 2017, and in fact it was legislated that there was an emergency response fund which was supposed to be set up. It has never been operationalized, and that needs to be done so that you can also encourage, for example, private health facilities are run by private investors. You cannot have them incurring huge costs which are never compensated consistently to be able to take care of, and that you know it's also against the law to be able to detain people for not paying bills. So there are a lot of facilities, especially those who are located along major highways, incur so that you can enormous cost in terms of being able to provide healthcare services to citizens, and I think that's the role of the emergency response fund.
We want to see issues of healthcare workers improve in this country 100%. We want to see issues of HPTs and technologies, healthcare products and technologies improve. We want to see issues of digitization optimal. We want to go to the optimal level, and health financing at the same time. Yes, we have moved leaps, but we want to go even further.
Kuna uchache wa CHPs. Mali kuna uchache, atuongeze tuko wengi.
We could make use of the community health providers to go down to the ground, to the mwananchi, to the mama mboga, to the boda rider, and just tell them whatever is available in the facilities, in terms of equipment and in terms of service provision.
I look forward to the President continuing providing that leadership that is required in ensuring universal health care is taken. And it's not just about the President, it's more important even we as citizens. If everyone takes their responsibility seriously, then nothing can stop us from achieving what we need to achieve.
About rubber meeting the road, that Wanjiku can access the care they need. Let me not even say care, the help they require. Help comes from both preventive, going to promotive, to now curative, as we're in curative.
Expectations for the improvement of services as we reach out to our households. We expect to be equipped with better kits and new kits and the refills that are lacking. We in the health sector have to up our game. You know, one is to ensure that we achieve universal healthcare in our country. Two, that we provide impeccable and similar services to our Kenyan people. Three, that our Kenyan people access all these services, you know, cheaply or in an affordable manner. That will make Kenyans healthy. Similarly, we also want to see how best we can actually create more efficiencies by automation, digitization, and embracing technology in healthcare space, because that's where the world is going.
We have called Kenyans here because health is a collective responsibility. It is not a one-man show.
Those were some of the expectations from allow us to welcome His Excellency the President to come and join us. When he's almost here, I'll just let you know so that we are able to welcome him. But as we wait for him to come, the reforms that this administration did were 4 major reforms. The first one was on the public health care, where we've seen community health promoters, and some of them are in this room. They'll be able to speak about their experiences and some of the people who have benefited from having community health promoters at their doorsteps. The one that all of us have been talking about the most is the Social Health Insurance Act that birthed SHA, the Social Health Authority, and marked the end of NHIF, the National Health Insurance Fund. The third one was on digitization, the Digital Health Act, which we should be able to unpack. And most of us have read, seen, heard a lot of stories about DHA. We'll be able to unpack all of those questions during this town hall. Then the fourth one was on the Facilities Improvement Fund, about facilities getting their own funding, investing in their own facilities, having that autonomy to decide what to invest in as a healthcare facility. We'll be able to hear from governors about their experiences, about, implementing some of these acts, implementing some of these reforms. But most importantly, like I'd said as I began this town hall, is that we want to hear from you, the citizen. These reforms are about our healthcare, about your healthcare. It's about that mother who's in a village. It's about that man who's seeing us and that woman who's seeing this town hall. And they have very many questions that they've been wanting to ask, or they've been seeking answers. So the people who are here in make it to this town hall, you will have an opportunity to ask any questions on their behalf. You'll be able to get clarity